All right, let's break down a really common but super important UKMLA station, the menstrual migraine case.
Welcome to this clinical walkthrough on the menstrual migraine case for UKMLA, brought to you by Mediate, your 24/7 practice partner.
Okay, so the consultation kicks off the second the patient starts talking. You've got a 17-year-old and she's clearly worried. Right away, her first sentence hands you two massive clues. These headaches have been going on for 6 months and she's really concerned. That's your signal, right there, to start building that rapport and kicking off a really systematic investigation.
So to nail this station, we're going to follow a simple 5-step game plan. First, opening the consultation. Then, screening for those all-important red flags. Next, we'll uncover that menstrual link. After that, it's all about explaining the diagnosis. And finally, we'll craft the management plan together.
All right, step 1. You need to get in the driver's seat and really pin down the presenting complaint. Your main goal here, to paint a crystal clear picture of what this headache actually feels like for the patient.
The trick is to be structured. Think SOCRTES, right? If you follow these questions, you'll find out the pain is on one side, it's throbbing, about a 7 out of 10, it lasts for 12 to 24 hours, and yep, it comes with nausea and light sensitivity. And hey, that question about aura? Super important. Finding out there isn't an aura is just as valuable as finding out there is one.
Okay, now we get to what is, without a doubt, the most critical part of any headache history: screening for red flags. Seriously, before the word migraine even crosses your mind, you have got to rule out the really scary, life-threatening stuff.
And listen, this is huge for the exam. The examiner, they're not just looking for a clever diagnosis. They're looking for a safe doctor. Asking about red flags right at the beginning screams, patient safety is my #1 priority. That's how you score big.
So look at this. It's a perfect cheat sheet for mapping your questions to those really nasty diagnoses. And you've got to ask these things explicitly. Don't beat around the bush. Ask, have you ever had a sudden severe headache, like a clap of thunder? Ask, any fever or stiffness in your neck? This is your clinical safety net. You can't skip it.
Okay, so you've done your due diligence. You know the patient is safe, and the headache pattern is starting to sound a lot like a migraine. Now, we're at the turning point of the whole consultation. This is where you pivot. You stop asking those broad questions and start getting laser-focused.
And this is it. This right here is the golden question, the one question that can completely unlock the diagnosis. And you just ask it calmly, directly, because you've already done the hard work of ruling out all the dangerous stuff.
See, that's the power of a focused history right there. The moment the patient says yes to that question, the entire direction of the consultation just shifts. Now you're moving with confidence straight towards a diagnosis of menstrual migraine.
But wait, one question isn't quite enough. You've got to lock it down, right? So first you confirm her period's irregular. Then you absolutely nail the timing with this killer question. So do the headaches start before your periods and then get better after they start? And in this case, she'll tell you, yep, they start 2 to 3 days before and they're gone once the bleeding begins. Boom, diagnosis confirmed.
All right, you've got your diagnosis. Now, the game changes. Your focus has to pivot to communication. This means, yeah, finishing up the history, but more importantly, it's about explaining what you found in a way that builds trust and really reassures the patient. And please, don't forget to wrap up the full history. A mnemonic like MAFTOSA can be a lifesaver here. You know, medical, allergies, family history, and so on. That family history is a big clue here, right? Her mom gets migraines too, and always ask how this is affecting her life. It's not just about showing empathy, it's about getting the info you need to tailor a plan that actually works for her. Now for a huge point score, ICE. Ideas, concerns, and expectations. You absolutely have to address this. She's thinking it could be a brain tumor. You have to tackle that fear head on. She's worried about her exams. You need to show her you hear that. And she wants pain relief and reassurance. That's your brief. Your management plan has to deliver on exactly those things.
When you're explaining the diagnosis, keep it simple. No jargon. This phrasing on the screen, it's perfect. Why? Because it's clear, it makes the condition sound normal, not scary, and it connects the cause, that drop in estrogen, directly to what she's feeling. It just takes all the mystery out of it, and that provides so much reassurance.
Look, getting this kind of patient-centered explanation just right, it takes practice, which, by the way, is a good reminder that you can practice this exact case right now and get objective feedback on mymediate.com.
Okay, let's get to the final phase.
putting together a management plan that's clear, safe, and really importantly, collaborative. This is where you turn your diagnosis into a practical, actionable plan for the patient.
So your plan needs two parts. First, for when an attack actually happens. Sumatriptan nasal spray is the way to go here, and you have to explain why you're choosing that. It's because the oral version isn't licensed for someone under 18. That's a key detail. Then, the second part is all about prevention and lifestyle. This is where you empower her. Things like regular sleep, making sure she's eating and drinking enough, and keeping that headache diary. Honestly, that stuff is just as important as any medication.
And this is crucial. No headache consultation is ever complete with solid safety netting. You have to be totally explicit. Go through the exact symptoms you see here and tell her, if you experience any of these, you need to get help immediately. This is non-negotiable. It's for patient safety, and frankly, it's for passing the station.
And to finish things off, you just need a professional close. Offer a patient information leaflet. It's a great way to reinforce what you've talked about. And then arrange a follow-up. Setting a specific time, like in 2 or 3 cycles, which is about 8 to 12 weeks, just shows really good clinical practice and that you're ensuring continuity of care.
So, that brings me to a final thought for you. A headache diary. It sounds so simple, doesn't it? But think about it for a second. How can that one simple tool do more than just track triggers? How can it actually empower your patient and transform them from just someone getting treatment into the person who's really in control of their own condition?
Putting all these pieces together smoothly is what's going to make you successful in the station. And the best way to do that? Practice. You can practice this exact case now on mymediate.com and really turn all this theory into solid practice.